We will be describing a doctor-patient interaction in which the patient is presenting signs and symptoms of viral meningitis caused by enteroviruses, one of the most common causes of viral meningitis. Today, we will be examining a 2-year-old female named Sophia Rosette, who was brought into the emergency room by her mother for persistent vomiting and a fever of 102.7 degrees. Her mother described that Sophia had been displaying signs of lethargy and had developed a large rash across her chest and abdomen with numerous raised, painful lesions. Under further investigation, it was found that the most concerning symptom that Sophia presented was severe neck stiffness. When the neck was flexed, Sophia's hips and knees flexed as well, which is an indicator of Brudzinski's sign. Brudzinski's sign is one of the hallmark indicators of meningitis. Due to the acute illness identified in Sophia, cautionary antibiotics were administered to her while waiting for the results that confirm whether or not the infection is caused by bacteria. The presence of Brudzinski's sign gave us the suspicion that Sophia may have contracted meningitis. We will use a lumbar puncture to tap into cerebrospinal fluid. Microscopy of the cerebrospinal fluid can establish the diagnosis of meningitis. The lumbar tap allows us to test cerebrospinal fluid white blood cell counts, protein concentrations, glucose concentrations, and more. Blood cultures will be drawn as well. Additionally, the lesions from the rash will be tested via direct immunofluorescent antibodies. Elevated cerebrospinal fluid white blood cell counts and the presence of red blood cells in their cerebrospinal fluid are indicators of infection and inflammation. The gold standard for diagnosing viral meningitis is location of viruses from the cerebrospinal fluid, blood, or urine. Cerebrospinal fluid or blood viral cultures are one of the most definitive methods of diagnosis for most types of viral meningitis, including most enteroviruses, but this test sometimes has limited ability and takes upwards of 4 to 10 days to receive a result. In more recent medicine, cerebrospinal fluid polymerase chain reaction, also known as PCR, has been a valuable tool since it is more sensitive and produces results faster than the cultures of cerebrospinal fluid, but this test is more expensive. In our case, we will use cerebrospinal fluid PCR to determine a diagnosis as quickly as possible. The image shown is an example of cerebrospinal fluid PCR results. Sophia's white blood cell count had been found to be in the normal range. Her cerebrospinal fluid tap shows elevated white blood cell counts. There is also 174 red blood cells per millimeter. The protein count is 148 milligrams per deciliter, and the glucose measure is 38 milligrams per deciliter. The skin lesions tested via direct immunofluorescent antibodies have tested positive for enteroviruses. The cerebrospinal fluid has also tested positive for enteroviruses in its PCR test. Based on these tests, Sophia will be diagnosed with viral meningitis. Since the cause of Sophia's meningitis was found to be viral, there is no cure for her condition. Therefore, she will be taken off the preventative antibiotics previously prescribed. She is advised to stay in the hospital for the duration of her illness. She will be put on a regimen of intravenous fluids to combat the dehydration and will be prescribed an antiemetic for the persistent vomiting. Finally, acetaminophen will be administered to control her fever and headache. Since Sophia is not immunocompromised, she is expected to make an uneventful recovery in about a week. Meningitis is defined as inflammation of the meninges, the membranes that surround the brain within the skull, and spinal cord within the spinal canal. In order to understand how meningitis affects the central nervous system, we must first understand the structures themselves. The meninges are layers of tissue that protect and sustain the brain and spinal cord. These layers are vital in the biological activities that occur in the central nervous system. Dura mater coats the inside of the cranial cavity and extends as a tube to invest the spinal cord and spinal nerve roots. The dura mater is the outermost meningeal layer. The outermost layer of the dura mater is comprised of a loosely arranged fibroelastic layer of cells. The middle region is mostly fibrous and consists of the endosteal layer and the inner meningeal layer, which is configured closer to the brain. The dura mater encloses the arachnoid mater and supports the large dural sinuses carrying blood from the brain towards the heart. Cranial and spinal leptomeninges, which means thin meninges in Greek, are composed of two connected sheets of cells, the arachnoid mater and the pia mater. The arachnoid mater is positioned in between the dura mater and the pia mater. It is given its name for its spider-like appearance. It is composed of fibrous tissue that cushion the central nervous system and is covered by flat cells thought to be impermeable to fluids. The arachnoid mater in both the brain and spinal compartments surround the arteries and veins and connect with the pia mater on the surface of the brain and spinal cord. The pia mater, Latin for tender mother, is very fragile. It is the innermost meninge and is composed of fibrous tissue. It surrounds and adheres tightly to the surface of the brain and spinal cord. This layer is also impermeable to fluid and aids in the production of cerebrospinal fluid. The blood-brain barrier is largely composed of ependymal cells and the choroid plexuses located in the ventricles. Ependymal cells compose the epithelium of the choroid plexuses, and it is this layer that separates the brain and spinal cord from the rest of the body. The blood-brain barrier plays a very important role in maintaining the health of the brain. Ependymal cells create an impermeable membrane through junctional proteins. These junctions are called tight junctions. Because of these tight junctions, most blood-borne toxins are prevented from entering the brain, so infections of the body don't harm the brain. There are spaces in between meninges. The space between the dura mater and the arachnoid mater is called the subdural space. The space between the arachnoid and pia mater is called the subarachnoid space and is filled with cerebrospinal fluid. The space between the dura mater of the spinal cord and the spinal cord itself is called the epidural space. There is also a space between the dura of the spinal cord and the arachnoid layer that is called the lumbar cistern. This is often the location for cerebrospinal fluid lumbar taps. Cerebrospinal fluid is the fluid produced from the blood in the ventricles of the brain. Its functions are to regulate the chemical compositions of the central nervous system, protect the brain during blood pressure fluctuations, and is a vehicle for transport of intracerebral matter. Enteroviruses are contracted via the fecal-oral route. Once contracted, they begin to reproduce outside of the central nervous system in tissues such as muscle, liver, and the gastrointestinal or respiratory tracts. The virus then enter the central nervous system using several mechanisms. Many enteroviruses invade by hematogenous spread, which means through the circulatory system. Virus particles can pass directly across the blood-brain barrier due to specific genes that can have an effect on the expression of enzymes that hold together the tight junctions in the blood-brain barrier. Viruses can also be carried across the barrier in infected leukocytes. Other viruses such as polio and herpes simplex virus manage to invade through the peripheral and cranial nerves. Once inside the central nervous system, viruses may use the cerebrospinal fluid to spread throughout the subarachnoid space. The inflammatory response from the body to these pathogens leads to meningitis. Viruses can also spread directly or through inflammatory leukocytes, also known as white blood cells, through neural tissue to neurons and glial cells. Once the infection of the central nervous system begins, inflammatory cells such as lymphocytes, which are a type of white blood cell, accumulate. This is paired with the release of inflammatory cytokines such as interleukin and tumor necrosis factor. Cytokines are signaling molecules that recruit immune cells to the site of infection. Meningeal inflammation produces the symptoms and signs of viral meningitis. The following two slides list citations for sources and links where pictures were obtained from.